Hello, future PTAs. So today we will talk about hydrotherapy. I thought it was only appropriate for me to record this from the middle of the ocean, so you're welcome. Uh, I cracked myself up. So here is our outline for today. More outline. Some of the properties of water. It is a solvent, which means it dissolves other compounds. It has resistance, hydrostatic pressure, and buoyancy, which we will cover in a minute. And there's a high specific heat and thermal conductivity. So the heat transfer is by conduction and by convection. All right. So resistance, that is determined by the speed of movement. So the good thing about water, if you're using, let's say, weights on the land, then you're only getting resistance in the direction that's going against gravity. With water, you're getting resistance in all directions, which is such a benefit because you can do very functional and dynamic movements and get resistance in all directions. The faster your body moves, the higher the resistance of the water. The slower your body moves, the lower the resistance of the water. If you use paddles or fins or do anything to increase the surface area that you're moving in the water, that will increase the resistance. Keeping the limbs straight in front would decrease the resistance, like with swimming. Keeping your arms straight and going directly in front. Hydrostatic pressure. So this is the pressure exerted by a fluid on a body that it is immersed in. The deeper in the water that you go, the higher the hydrostatic pressure. So that's Pascal's law, that a fluid exerts equal and inward pressure on all surfaces of a body at rest in proportion to the depth of the body in the fluid. So the deeper you go down in water, the higher the pressure. Buoyancy, that is the upward thrust of water against gravity. That is why we can float in water. And the density of the human body is less than water, so that's why we can float. Now, the more, so fat is less dense, lean muscle and bone are more dense. So the higher bone density somebody has, or the more amount of lean muscle someone has, the more they will sink in the water, and then the more amount of fat tissue their body is composed of, the more they will float in the water. And then one good thing about buoyancy is that it decreases the stress and the compression of weight-bearing structures. It kind of de-weights, it opens up the areas and allows you to do resistance training and exercises without the effects of that compression that we get from weight bearing. Physical properties of negative pressure wound therapy, which I cannot, as I discovered while I was making this, I can't hardly look at a wound without just like grimacing. So I'm glad I don't work in wound care, but some of the effects are subatmospheric pressure, suction, aspiration, and then fluid installation. So negative wound therapy, it cleanses and helps with tissue healing. The way that it cleanses is by softening the material, it exerting pressure on that area, debriding the agents or the escudate, the necrotic dead tissue from the area. So like scraping it off, throwing it away. And then you can use antimicrobial or surfactant additives to increase the effectiveness. With tissue healing, it does this by maintaining a moist wound bed and removing waste from the area. You have to be a little bit careful because the water can also remove some of the good cells. So you don't want too much pressure, too long of a duration or anything like that. But you do want to remove the waste if possible. All right, some of the physiological effects of water therapy. It has benefits for the musculoskeletal system, the cardiovascular system, respiratory system, renal system, that's your kidneys, and then psychological benefits. So we'll go through each of those. With the musculoskeletal system, the buoyancy decreases weight bearing, so it allows you to do movements and build strength and endurance without any damaging effects of that weight bearing. It provides resistance in all directions to help with strengthening and assistance for patients who have difficulty with land-based exercises. So even people with minimal strength could get in the pool and be able to move more freely than on land. This is just a chart to show you, like, the deeper you are in water, the less amount of your body weight that you are weight bearing. So if the water just comes up to your ASIS, so basically your waist, then you are still weight bearing about 50%. If it comes up to the xiphoid process, then you're weight bearing about 33% of your body weight. And if it goes all the way up to your neck, you're only weight bearing about 10% of your body weight. So it definitely matters how deep you are in the water for the effect of buoyancy versus gravity on your body and how much compression is happening through those joints. All right, so for your heart, um, the hydrostatic pressure helps increase venous return. That's the main benefit. So the pressure on the extremities pushes the venous blood flow back to the heart. And when you're immersed all the way to the neck, your central blood volume increases by 60%. Your cardiac volume increases by 30%. And so does your cardiac output. Your heart does not have to beat as high in response to exercise. And we usually use that scale, that rate of perceived exertion scale, in order to determine, what level a patient is and determine the intensity. Be very cautious because when you're in the water, you don't usually sweat as much. Your temperature doesn't go up as much. Your breathing doesn't go up quite as much. Sometimes it can. Your heart rate doesn't go up quite as much, but you are still doing difficult movements that can cause muscle soreness. So sometimes you don't feel like you're doing much until you start walking up the stairs on gravity and your legs are all shaky. um, so you want to just be careful and monitor them throughout so that you don't overdo it. Push them too far. Remember that rate of perceived exertion. There are various types of scales you can use. You can use a 0 to 10, or the Borg is the 6 to 20. I personally like to always use the 0 to 10 because people are familiar with that type of system. And I also like, when possible, to have a rating scale with pictures of faces on the wall. So, like, it's a smiley face that's really happy for a lower level and that looks like they're about to die for a higher level, because people really have a hard time giving that number unless they have like a visual cue. Respiratory effects, it actually increases your work of breathing. So it has the um, hydrostatic pressure increases the pressure on the chest wall, which decreases your vital capacity. It increases circulation in the chest cavity, but it also increases the amount of work it takes to breathe. So it can help you build those respiratory muscles, but it does make it just a little bit harder to breathe. And then the humidity actually helps people who have asthma. It can decrease the likelihood of them having an exercise-induced asthma episode, but you have to be also careful with that too, because if you push them too far, then they're still just as likely. So you have to just, it's kind of like a fine line of how much is too much. But the humidity can help decrease the symptoms of the asthma as well. The renal effect, so it increases urine production by increasing the renal blood flow, the central blood volume, by decreasing the ADH and aldosterone, increasing the urine potassium and sodium, and decreasing your swelling. So after you've been in a pool for a while, a lot more blood has been circulated and filtered through the kidneys and ready to be released. But don't pee in a pool. Some of the physiological effects, sorry, I thought I skipped a slide. It could be more relaxing, like in hot water or warm water. It could be invigorating, like jumping in cold water. And it has good I'm sorry, I keep saying physiological, psychological, mental effects for adults and children alike. I personally, in working with children with autism, have noticed big benefits in their like behavior modulation or their ability to regulate themselves after being in the water. So we've talked before, I believe we have, but if we haven't, this is new, that everybody has kind of an internal motor, and you can be a little bit too high and overstimulated. You could be a little bit too low, about to fall asleep. And we learn best and we perform best when we're somewhere in the middle, when we're kind of at this sweet spot of being alert enough to learn and listen and perform, but not so overstimulated that we have to kind of check out. And so there's certain activities that can help upregulate and wake somebody up, and then there's some that help downregulate and get people down from an overstimulated um, feeling inside. And so what is great about water, and there's other activities too, like swinging and things, is most of the time water can actually both up and down regulate. So wherever you're at, it can help you get to that sweet spot. Same with horseback riding. That's why equine therapy or hippotherapy is a great thing for a lot of children who have trouble with regulation, is that like deep impact and movement, and that kind of rhythmic movement on the horse's back and things, can all of those things, water, and those movements can all help regulate somebody and kind of get their intensity a little higher if need be, or lower if need be, and get them in that sweet spot. So a lot of times they will use more words after treatment, using either hippotherapy or water-based therapy, or they will have less, behaviors like maybe crying or different things that they may have some issues with. So very cool thing to use with the pediatric populations as well. All right, so negative pressure wound therapy is used for wound care. That's pretty much the only indication. Um, and it accelerates wound healing. It helps rehydrate, soften, and debride the area, and it may improve circulation to the area as well. Some of the considerations: you could use immersion versus non-immersion types of wound therapy. You could use an additive. You could, and that's like a cream to add on the surface. It could be painful for the patient, so it may or may not be a good um, treatment for them based on if they can tolerate the pain or if it's too painful. And then you can use some vacuum assisted for the negative pressure wound therapy. So just kind of determining what you're going to use and what's going to be best for the patient. All right, so some of the indications for hydrotherapy is with edema control, because it can help pull edema out of the extremities. Water exercise is great, getting that heart pumping and the resistance from the water. And then you can also, of course, use water for heating and cooling, and get those thermal effects depending on what your goal is for the hydrotherapy. So with the edema control, the hydrostatic pressure pushes on the limbs and increases the venous return to get the edema out of the limbs and the blood flowing back to the heart. It results in changes in circulation and kidney function. It requires deep immersion, and the cold water may also cause vasoconstriction and reduce vascular permeability. So the water temperature really matters. You do not want to have someone immerse in hot water if it's for edema, because then it's going to increase the circulation and make the edema possibly worse, but definitely not help it. With the exercise, you can do swimming, running, walking, and really any activity that you can do on land for therapy, you can do in the pool. So you can even do passive range of motion, active range of motion, stretching, um, I don't typically do manual therapy in the pool, but pretty much any exercise or therapeutic activity you can do in the pool, just like you can on land. Remember, though, that there is resistance in every direction, so they may actually fatigue more quickly than they would on land. A tether is just like a rope tied to the person, and usually secured to the side of the pool to kind of keep them from floating around the pool. You may or may not need that depending on the person. Some of the reasons that we use water therapy versus just on the land is to increase circulation, muscle strength, joint viscoelasticity, flexibility, range of motion, ambulation, coordination, cardiovascular and vascular conditioning, and then psychological well-being. It can decrease pain, decrease muscle spasms, decrease stiffness, and it can even increase strength and endurance. I know that when I was in PT school, we went to Shepherd Center in Atlanta and um, worked with patients who had spinal cord injuries in the pool. And it was just such an interesting experience because some people who had very minimal movement on land, you could put them in the pool with flotation devices and they had some free mobility. Like even people who were like spastic quadriplegic, they were able to move some in the water without assistance. And I knew a couple of the patients mentioned that they felt the most free and the most like themselves in the water because they had some control over their movement. And so you can really give people some, abilities that you can't on the land. Some of the benefits for orthopedic rehab, decrease in the weight bearing, the compression on the joints, um, the resistance. You can change how much resistance based on what your desired effect, based on the speed or what equipment you use in the water. You can do open chain and closed chain exercises. You can help with bone density, help with fibromyalgia, and a lot of conditions. With neurological rehab, the water helps increase the proprioceptive input. You can do some of the exercises more safely in the water, help with balance training. Even if they start to fall, it's a little easier to catch. And if they do fall, as long as they can swim and stand back up, then typically there's not really a risk of injury with falls in the water. Um, with cardiovascular conditioning, it really helps condition the patients with poor tolerance to land-based activities. So maybe they can't walk much on the land, but can walk a lot more in the water. Some other benefits for pregnancy, it can help decrease the weight bearing because, of course, the additional weight and swelling and all the things that come with pregnancy can be harder on the joints. It can allow them to exercise with less of an increased heart rate and a less of a risk of overheating. People who have exercise-induced asthma are less likely to have it when they're doing water exercise. And then for the geriatric population, you can work on things like balance, strength, cardiorespiratory fitness, and all types of functional mobility. All right, so closed chain in the water, just like on the land, you would have to have one like your legs fixed. So you'd have to be weight bearing for it to be closed chain. So you would essentially have to be in shallow enough water that you could do a weight bearing exercise in order for it to be considered closed chain. So if you're floating in deep water, then all you're doing is open chain exercises. So you can perform all sorts of open chain in the deep water. And most of your closed chains would pretty much all have to be performed in the shallow water. So if you're using the water for superficial heating and cooling, remember water transfers heat by conduction and by convection. Some of the advantages is that it's in perfect contact with the skin, so you don't have to worry about the hot pack falling off or sliding off or not touching the areas that you want heated or cooled. You don't have to fasten them to the body. You can move in the water, and so you're getting maybe the thermal benefits and the movement at the same time. Some of the disadvantages is that if it's too warm of water, it may increase edema. The dependent position could also increase edema, but typically the hydrostatic pressure keeps it from doing that very much. So just keep that in mind. Contraindications, of course, you're going to have to know these when you are thinking about immersing somebody into the water. You don't want to have anybody deep in the water who has cardiac instability, any open wound or softening of the tissue around the wound, which is the maceration, bleeding, any infection that could be spread by water, any bowel incontinence. Usually you don't want to do it with bladder incontinence either if they had uncontrolled epilepsy, confusion, impaired cognition, or suicidal patients. So don't want any of those in the water. For negative pressure wound therapy, some of your contraindications are necrotic tissue with eschar present. So necrotic is dead tissue. Eschar is that thick, hard covering over a wound. Untreated osteomyelitis, that's a bone infection, malignancy, so cancer in the wound, untreated malnutrition, exposed blood vessels, nerves, organs, non-enteric and unexplored fistulas. So a fistula is basically a tunnel from one tissue to another that connects the two tissues that should not be connected. And the tunnel is typically created by a wound that has either been infected or that is not healing. And so it tunnels its way through and opens up an area between tissues that should not be connected. So you would not want to use a wound vac with somebody who has a fistula or a tunnel in the wound, or an exposed anastomotic anastomotic site, which is a surgical opening between two structures that typically would not be connected. So it's basically a tunnel that has intentionally been created. If it's exposed, even if it was a surgery that created that, you do not want to use a negative pressure wound vac or therapy for that patient. With precautions, so if we're talking about hydrotherapy and going down in water, if they do not, if their sensation is impaired and they're not able to tell the difference between hot and cold in the area that's immersed, just be very careful about that, especially if you're doing it for thermal benefits. If they have been drinking alcohol, if they are so weak that they would not be able to move around in the water, if they're very scared of water or have urinary incontinence. If the water is really warm, you do not want someone who is pregnant or has multiple sclerosis or poor thermal regulation to be in that warm water. For non-immersive water therapy, if their tissue is too soft, you do not want to use that if they ever had a recent skin graft, or if you just don't think it would be helpful. And then for negative pressure wound therapy, the precautions if they have a high risk of bleeding, like if they've been on blood thinners for a long time, or hemostasis, or if they're confused or disoriented. Some of the adverse effects of water therapy. Hyponatremia is a decrease in the amount of sodium in the bloodstream, which is not the ideal situation. So you have to just be careful about replenishing electrolytes and things like that. Infection, drowning, burns, fainting, bleeding. Burns would only be if the water was way too hot. Aggravation of edema is a possibility, and even though typically it helps asthma, it could exacerbate the asthma as well, just depending on how much they're doing and on the severity of their asthma. With negative pressure wound therapy, if you use it on somebody that you shouldn't, it could possibly cause some significant bleeding and really the worst effect possible, death. So you have to be really careful not to use it on patients where it's contraindicated. Application technique, as always, you evaluate the patient, determine if it's safe, you select which intervention is appropriate, then you tell the patient, explain it, what you're doing, and then apply, either get in the water or apply the negative wound vac, wound therapy, and then you reassess and determine, do they have any benefits? Is their pain less? Have there been any changes after the therapy? And then you document what you found, what you did and what you found. One of the types of non-immersive irrigation is a pulsed lavage. So it's this machine that you put on the wound, and it can do some of the benefits, but there's less of a risk of infection than Whirlpool, which is why Whirlpool is not really used in therapy anymore, is the high risk of infection. You can control the pressure between 4 and 5 psi, and psi stands for pounds per square inch. And then there are different types of devices that you could use for this. Different devices are available, and you'll have to just read before checking a device, the specific instructions for each device before using it. So you make sure that you're using that device based on the recommendations from the maker. With a pool, one of the main things you have to be careful with is the water temperature. So the recommended temperatures are between 79 and 97 degrees Fahrenheit. The cooler temperatures are for more intense exercise, if you're trying to increase alertness, things like that. The warmer temperatures are for more low intensity exercises or for somebody with spasticity that you're trying to loosen them up by being in the pool. So you have to just really be a little bit careful which temperature the pool is. Most of the time, I mean, you can set it, but you have to set it days in advance. So whatever you show up to, it's determines can you even get in the pool or not. Is it too hot, too cold? You're not going to be able to change the temperature once you get there. So just paying close attention to how it is, and you can get in but not stay in as long, or you just have to monitor the patient a little more closely, just depending on your goals and the temperature of the water. And then certain exercises can be used with underwater treadmill or with a pool that has a underwater flow rate that has kind of like a stream pushing out that you can walk against resistance. So there's different equipment that you can use based on what's available and where your treatment is. Some of the safety issues is you got to keep the area around the pool safe. So wet, slick surfaces are going to be very dangerous for people with balance issues. So be very careful with that. Guard them very closely as they're getting out and walking around the pool, especially after the therapy, because then they're going to be more tired and more wobbly anyways. Pay close attention to the cleanliness of whatever devices you're using in the pool and that they're getting cleaned on a regular basis. And then, of course, you're going to have need somebody that's trained in pool maintenance and keeping the water at the right, I don't even know what all they test, but they test all kinds of tests on the water to determine what chemicals they need to put in to keep it safe and clean. With documentation, you want to document the type of hydrotherapy you use, the patient's positions, or if you're doing like pool therapy, what activities you did, reps and sets, just like you would on land, the water temperature, the treatment duration, the fluid pressure, any additives you use, that's more so for the wound vac, the response to the intervention. So some of the same things that you document for every other type of modality that we use. All right, so that is it for us for the hydrotherapy. And sorry, I was trying to figure out how to stop the recording. I'll see you in the next lecture.